People are ready to work in the medical field. What is something you have had to explain to your patients that was super ridiculous and should be common knowledge? To an 84-year-old man with a candle stuck in his rectum, that you don't need to massage your prostate with a candle once a month. A doctor had apparently told him 15 years ago to do this and he had not questioned it since. Firefighter EMT here. Just because you're taking medication for something doesn't mean it's gone away. Here's a real conversation that happens about once or twice per shift at minimum. Me. Do you have any medical history, diseases, sicknesses and/or conditions I should be aware of? Patient. Number. Me. Are you currently taking or supposed to be taking any medications? Patient. Yeah, I'm on. Insert 12 different medications here. Me. I see one of your medications is metformin. Are you a diabetic? Patient. Not anymore. I just told you I take meds for it. I had to explain to my 75-year grandmother that there isn't one straight tube connecting your ears. She put eardrops in and put cotton in her other ear before she lay down so it wouldn't leak out. Those instructions must have gone in one ear and out the other. Having to explain that I can't figure out what is wrong with them over the phone. My mom called me and asked me what the rash on her elbow was. After 5 minutes of trying to explain that I needed to see the rash, I finally asked her what she thought of the shirt I was wearing. Took her a couple of seconds to figure it out. You're more likely to die from a dental abscess than dental's raise. Doctor, Oz is full of crap. I also hate it when people say, well, if they are so safe, why do you step out of the room and they act like they freaking stumped me? The reason I step out of the room when taking raise is because I do that almost every day. You get it once every 3 years. I don't know if this is a good analogy, but you equate it to a bartender asked to share a drink with his customer. You can have a drink every once in a while, but if the bartender has a drink with every customer, he'd be very sick. Overweight lady with some liver damage. Had many conversations about diet and reducing alcohol intake. Patient had cut out whiskey and vodka, but did not know that Guinness had alcohol. Yes, this was in rural Ireland. My personal favorites are when the families of a loved one bring in food that is completely counter to their current medical condition. Off the top of my head, I have had a family bring in a get well cake to their dad who was on his 5th or 6th admission for DKA, diabetic ketoacidosis. He was still on an insulin infusion and the family didn't seem to see the program with giving him a cake because he woke up and was hungry. I've had families order in pizza to have a pizza party when their parent is admitted on the cardiology ward and on a salt and fluid restricted diet due to extensive heart failure. Good times. Paramedic friend of mine has had to explain to multiple people that diabetes is not something that everyone ends up getting in life. When a woman lets her diabetic son eat ridiculous amounts of sugar, then gets him to run around in the yard to burn it all off because I don't like pumping him full of that insulin. That's not how this works, lady. You mean alcohol will damage my liver? Shadowed a dentist in a rural area where most patients were in poverty. One guy was so confused on why his teeth were rotting. He revealed that his diet consisted of sugar, and alcohol. The dentist had to explain sugar can lead to enamel loss. The guy said nope, that is a lie. Taking a medication twice a day does not mean taking the doses together. One dose now, one dose later, not both doses now. Repeat patient of the STD clinic I work at. Isn't there something I can buy, like, over the counter so I don't have to keep coming back in for chlamydia? Me. Condoms? Dirty dong patient. No. Miss, I meant, like, tea or something. Once had a diabetic patient who told me that his way to control his blood sugars was to put a tablespoon of sugar in his mouth, wait a few seconds for the diabetes to come to his tongue and then bang, a shot of Bagasso, a kind of brandy, and that way the diabetes would die because of the alcohol. Had a hard time explaining to him how these things really work. In nursing school, my labor and delivery teacher was covering contraceptives and demonstrated how to show patients how condoms are used by putting them on our thumb. At the end of it, she emphasized, make sure you tell them it doesn't actually go on their thumb, that the way you've put it on a thumb is how it should be placed on a dong. I had a patient that was truly concerned that his cancer was contagious. He wanted to know how to keep his puppy from contracting it. He was literally more concerned about his tiny puppy getting cancer because of him than his own health. I'll never forget the relief and joy I saw in his eyes when I told him he could have all the puppy cuddles he wanted. Oh man, that's super sweet. Dumb as heck, but still, super sweet. For purposes of surgery, vodka is not a clear liquid. Yes, all those cupcakes, brownies, and candy your family has been supplying you with this difficult hospital stay for a rotator cuff surgery might be the reason your blood sugar is 450. Patient's daughter, should we get her the sugar-free candy? In my head, I was thinking more of a veggie tray. Well, that wouldn't spike her blood sugar like that candy has been. The catheter in your dong makes it feel like you have to pee, but you don't. It does it for you. No, don't just pull it out. You'll shred your bladder and seriously regret it. You're screaming right now because you're trying to pull out your catheter. Please stop. No, don't throw your pee bag at me. You'll be arrested for assault. A few years ago, I was taking care of a woman from a rural part of our state. She had just been diagnosed with pancreatic cancer and it wasn't looking good. Her husband was kind of keeping her distance from her. As I was doing something in the corner of the room, he came up to me and whispered, "I can still kiss her, right?" I then had to explain to him that cancer is indeed not contagious and he won't catch her cancer. It was kind of heartbreaking. Oh man. 1. Soda has sugar. I had a diabetic man who didn't realize this. I just don't understand how it was even possible to not know this as a grown-ass adult. 2. Pouring Lysol on your diabetic foot ulcer won't keep it from getting infected. 3. When we said clear liquids only like jello, water, and popsicles, we did not mean you should convince your mother to blend you some McDonald's burgers and fries so you can drink that through a straw. 4. Unless you've already done it at least once before, pushing a baby out will neither be a pleasant nor quick experience. Had a couple that had been trying to get pregnant for over a year without success. Turns out they had slept together once and were waiting. Per our professor, she was counseling a couple and was starting to consider doing fertility tests before it came out that the couple were using condoms every single time. When you were told not to eat 12 hours prior to surgery, it wasn't just a polite suggestion. We had a patient coming in who we told not to eat or drink anything, even water. So he drank Gatorade since we told him he couldn't have water. Yes, gonorrhea really is an STD. An executive once came in complaining of bumps on her tongue. She was worried they might be cancer. I got to write my favorite encounter note thus far in my career. Complaint. Bumps on tongue. Asymptomatic. Exam. Tastabuds. Assessment. Tastabuds. Plan. Reassure. I work in MRI. When we tell you to remove all piercings before your scan, we're serious. You can take out your belly button ring before you go inside the tube, or the machine will take it out for you. You'd probably remove it more gently than the machine, though. I don't work in a medical profession, but I do work in another place where terrible diseases run rampant and staff spend every waking moment fighting them off. A school. There was nothing more bizarre than explaining germ theory to a teacher. She honestly didn't believe that such a thing could exist. She sincerely believed that sicknesses were caused by negative energy and bad auras, and asserted that it was fundamentally impossible for something as small as a germ to harm something as large as a human body, if something that small could even be alive in the first place. She spouted off something about how a creature that small would be incapable of living for more than a few seconds, because energy can only get so small. A germ, she did finger quotes, could only hold enough energy to live for 1 or 2 seconds, at most. These are the people educating your kids. Caring for a woman in her 80s, had to explain to her that you don't pee out of your coochie. There is, in fact, another hole. I'm a veterinarian and I don't understand owners sometimes. I work at a clinic of a vet who's also a private animal nutritionist, so sometimes we do house calls for special cases. Client Bob's dog isn't eating well and he has no clue why. I go over and ask him to show me his feeding routine for his dog. He fills a bowl with kibble and the dog seems super excited to eat. I crap you not, he then goes over to the fridge, takes out the ketchup and drenches the kibble in ketchup. By this point my jaw is hanging open in shock and I can see that the dog has suddenly lost its enthusiasm for the meal. I ask Bob politely what he's doing and he tells me that his entire family has ketchup on every meal. I then spent the next 15 minutes explaining to him that his dog may not like ketchup on its food. Now the dog eats great. I'm a miracle worker. Sticking the blade of a steak knife in your ass won't cure your constipation. I really wish this was a joke. That yes, guys can be nurses too. I'm a guy, a nurse. No, I'm not a doctor. Yes, maybe I should have been a doctor instead, or maybe a woman. Paramedic here. Had to tell a 19-year-old that she needed to change her tampon more than once a month. She was in septic shock. BTW. My sister isn't a doctor in Chicago. She once had to explain to a Mormon couple on their wedding night how to have intercourse. The 19-year-old man had taken his 18-year-old bride into the ER convinced his wife didn't have a hole. She had to tell a mother of four that giving your children a heavy doses of vodka did not kill the bacteria in their bodies when they got colds. She also had to report that obviously, she had a very frightened 23-year-old girl come to the ER very afraid because she had found a growth in her crotch. It was her clit. When my sister was asking her how she had never noticed it before, the girl responded, "My mom told me if I touched my area that the devil would get me." The girl had lived for 23 years without ever touching or seeing her own lady parts. A female patient came in and told the doctor that she has been bleeding every month down there, thinking it had something to do with the birth of her daughter. Yeah, I can't emphasize enough the importance of health education. Birth control does not go in the hoo-ha, unless it's a NuvaRing. Then stash that puppy up there like you're saving it for later. Wanting someone to make you a cup of tea is not a good reason to call an ambulance. I once had a pet owner whom I prescribed prednisolone tablets for ear infection. 1 week later I saw the dog and it was no better. I asked the owner if she had been giving the tablets. She said yes, and I asked how she gave the tablets. She promptly put the tablets in the ears of her dog. Even if she's on top, the girl can still get pregnant. But, gravity. Smoking M instead of taking your epilepsy medications is not a good idea. My wife is a postpartum nurse and on more than one occasion she has had to explain that the baby does not come out of your butt. I work in a hospital. I was getting some history from this lady when she told me she was allergic to epinephrine, that is, adrenaline, you know, the stuff in EpiPens that you'll give to people when they have an allergic reaction to stop anaphylaxis reaction. So I asked her what reaction she had the last time she was given epinephrine, and she told me that it made her heart race and she couldn't settle down. Had to explain to her that that means it worked. Oh man. I work at a pharmacy and we get crazy questions all the time. We had gotten a phone call from a seemingly distressed woman asking if we carried a larger sized NuvaRing. My first thought was, holy crap, how big is your vagina? But I realized that there is only one size of NuvaRing. So I told her to come up to our help window and we can try to figure out what the problem was. When she finally came up, I crap you not, this will most likely be one of the funniest things I have ever seen. She comes up, and she is honest to God wearing the NuvaRing as a freaking bracelet. Her actual thought process was if she wore the NuvaRing on her freaking wrist, she could have all the unprotected dude that she wanted and be just fine. The look on her face when we told her that it was an internal contraceptive, she turned ghost white and gave a meek thank you and hauled us out of the pharmacy. I felt bad for her, but I could not help myself from laughing. My cousin-in-law is a physician. She had to explain to a then pregnant woman that her NuvaRing had failed because she was not in fact supposed to chew it up and swallow it. You have been visited by the doggo of dandy rides like this video and have a dandy day. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.